What are dental implants?
Dental implants are simply tooth replacement. This little model here shows kind of natural teeth. This clear part would represent bone and gum. We don't have the natural colors, otherwise you wouldn't be able to see it. And the one in the middle shows the dental implant. So what the implant does, it simply replaces the root of the tooth. So if you have missing teeth, let's look at this thing here. Now there's one missing tooth right here. There's different replacement options. And in case the best replacement option that replaces the natural tooth would be the dental implant, which later on would be restored right here with a crown, which represents what we see in the mouth and we refer to normally as tooth.
What are the options for replacing a missing tooth?
There are many options to replace missing teeth. People often ask me, what are my options? The first obvious option is to do no treatment at all. Having said that, people do want to replace missing teeth. The simplest, the least expensive option, in a sense, a conservative option, is to do a denture. If all the teeth are missing, people can have a full denture. This is the upper denture. There are also partial dentures. So only if some of the teeth are missing. I'm showing here cast partial dentures. We call them cast because there is a piece of metal right here. It's usually thinner and stronger than something like this, which is made just out of plastic, acrylic as we call it. So this is the partial denture solutions. They are removable. So they are taken out for cleaning and they can be taken out at nighttime. In most cases, the people do take them out at night. There are cases where we recommend people keep them in at night so the jaw is supported in the right position. The next standard option for replacing missing teeth is a bridge. A bridge is something like this. It is got two abutments, kind of like a normal bridge over which one we walk or drive. Abutment, and in the middle, the fake tooth, is called a pontic. Now, this standard bridge requires that we cut the abutments, the teeth that hold the bridge. So this is something much more aggressive. It may lead eventually to root canal, where the tooth requires root canal treatment because the nerve inside dies. Inside the tooth, there is this flesh and blood, literally, which lives and breathes. And if we injure the nerve too much, either with a crown preparation like this, or with a big filling, the nerve may die, and then we either need to pull the tooth out, extract it, or we need a root canal. So that's basically the standard bridge. The best option is to do an implant. What do we do there? If the tooth is missing, we do not involve the neighboring teeth at all. We place this fixture, as we call it, or implant, in a layman's term, and that replaces the root. And then the implant has this little part, which is used so that we can put the crown on it. And that's the tooth replacement. So that's the implant option. Implants are a little bit more expensive than the other options. However, as far as the health is concerned, the natural looks and the function, it's the most one like natural tooth.
How long do dental implants last?
We would like to say that the implants are going to last forever. That may or may not be the truth. In fact, most of the implants should last 20 plus years. It's like anything else. If you take good care of them, they will last you a lifetime. If there is a gum disease or heavy bite where there's clenching, grinding of the teeth, they may break and they may fall out, so they may only last 5 or 10 years. It varies per person. Our experience is, and generally in dentistry, that the implants should last 20 plus years.
What's the dental implant procedure at your office?
Anybody who is interested in a dental implant will first come to our office. We will do a general examination and assessment. When the implant is considered, we will do special steps. We will collect what we call records. So we will do either a mold, or now we have a newer technology, special camera that takes a three-dimensional scan, so we can later on get the models of teeth. see how the teeth come together, how is the bite, etc. Many considerations go into it. Oftentimes, we will send patients for a specific x-ray. We call it CBCT, which is basically a three-dimensional x-ray, so we can see how much bone do people have. It's kind of like a tree growing in the ground. If the soil is shallow, you cannot plant a tree. The same thing with an implant. When we want to put an implant, well, it has to sit in a bone. If we have an implant that's that long, well, we have to have a little bit of extra bone. So those specific x-rays allow us to determine if there is enough bone. If there's not enough bone, the bone has to be reconstructed. It is possible in many cases. It's just an extra procedure. So once we determine that the patient is a good candidate for an implant, we will book an appointment and we will place the implant. So we will place that little tooth replacement, the screw as you can call it, in the bone and we'll let it heal. In general, the healing will take 3 to 6 months. After that time, we will bring the patient back. We will see how the implant is and we will expose, as we call the implant. And then we will take, again, a mold or a scan. And about a week later, the crown will be ready. And we will either screw it in most cases or sometimes glue it to the implant. And the case is closed.
Do dental implants hurt?
Actually, in most cases, dental implants are very easy. Sometimes people say, oh, I'd rather pull the tooth and then have a denture or do nothing. As a matter of fact, in most cases, the dental implants are easier than even a complex filling or root canal or extraction. When they come to have the dental implants placed, there is freezing or a local anesthetic placed. We put the implant in, and then afterwards, everything is sutured up, cleaned up. You may need some painkillers such as Advil, ibuprofen, Tylenol, and then most people forget that they have the dental implants placed.
Who may not be eligible for dental implants?
In most cases, most patients are good candidates for implants. The most obvious cases are, first of all, people who have really bad oral hygiene, people with major gum disease. Implants do not get cavities. However, implants can get the gum disease, the same type as the teeth. As a matter of fact, implants are more prone to the gum disease. So when you come to have an implant placed, we have to make sure that your gums are healthy, that your mouth is, so to say, nice and clean. Also, the people who have not had teeth in their mouth or who had the extractions many years ago, the bone basically shrinks. There's that good old principle, use it or lose it. So if somebody had an extraction done 20, 30 years ago, the bone that was there is no longer there. They may need to have a procedure so-called bone grafting, which is basically rebuilding the bone to the level where they can house the implant. Or in some cases, unfortunately, people cannot have the implant because there is not enough bone, and no matter what we do, it cannot be done. So for the majority of people, implants are a good viable option. However, a few unfortunate individuals may not be able to have it simply because they do not have enough bone. And of course, those with poor oral hygiene and major health issues, such as uncontrollable diabetes, for example, may not be a good candidates for implants. The other group of people is people with osteoporosis who are on certain drugs that may not be able to have implants while being treated for it.
What happens if I don't replace a missing tooth?
If the missing tooth is not replaced, in majority of cases, the neighboring or adjacent teeth, as we call, will move towards each other. So there will be movement, tipping. The opposing teeth, particularly the top teeth, normally they hit against each other. If we remove the bottom tooth, the top teeth may start growing further down. So in most cases, there is just tooth movement. Also, the fact if we lose teeth, particularly in the back of the mouth, lots of teeth are doing chewing. The first molars are said to do 50% of chewing on that particular side. So you can imagine if you lose one or even two molars on one side, the remaining teeth are going to be burdened with extra pressure doing chewing, clenching, grinding, and are more prone to wear and destruction. So replacing teeth is important.
Can I eat normally? And how do I care for dental implants?
Most of the time, when you have a dental implant, you can eat normally, your regular foods. Having said that, it does take a little bit of getting used to, particularly if there's many dental implants. With a natural tooth, one can feel the biting forces. With implant, it is something that sits right in a bone. So the feeling is slightly different. It takes a little bit of getting used to it. Kind of like if you have an arm or leg replacement, it will take a little bit of getting used to. In cases of multiple implants, it takes longer than with, let's we say, one implant. As far as cleaning the teeth is concerned, it is slightly different too. There's different ways of flossing the teeth, brushing the implant teeth. So yes, it's slightly different routine. However, after a few days or weeks, it should be just like normal.